So welcome, first of all. I have written down a few words, I hope you don't mind, so I'll read them to you. Welcome, and thank you for joining us. This session is being recorded, and as you know, it's being recorded and being sent live to Facebook at the same time. So we're really delighted to have everybody here. We're going to be asking questions at the end. This is going to be a slightly informal chat, really, in the style of a kind of an interview between myself and Dawn. We sort of had a discussion about this yesterday and felt that that might be a nicer way to kind of like conduct what might be considered to be particularly challenging, difficult and even triggering subject matter. So I hope that you approve of our approach and the way in which we're going to conduct this as well. So do make sure that your name is there so that when we do come to questions at the end, we'll be able to address you by your name. And of course, you're very welcome if you're joining us on Facebook. We would very much love to be able to also see your questions and comments coming in on Facebook as well. And the lovely Matthew is going to be fielding those questions and comments when we come to the end as well. So that's going to be quite a wonderful thing. So we're going to be looking forward to that. This is triggering subject matter. Please take care of yourself. If emotions coming up for you, then do your best to be able to deal with those emotions. If it means that you need to turn the camera off, get up, move around, walk about, then please do so. But we will do our absolute best to take care of you as best as we can. But it is a triggering subject matter, and it's one of the reasons why I think that these things do also need to be held in a conversational environment. So that's what we're going to hopefully do. Weston-super-Mare Town Council passed an anti-racist resolution at the end of November 2020. We now have had a number of meetings with local community groups, and it was birthed out of one of those meetings that we decided to do a talk on the subject of well-being and mental health, a particularly important conversation at this time. And we welcome the wonderful Dawn Jarvis, who is going to lead us into this. She's known as the diverse nurse, which I particularly like because it rhymes. She is a diversity and inclusion strategist, international speaker, executive coach, author, founder of the Diverse Nurse Network and creator of Dawn Jarvis podcast. So welcome, Dawn. Thank you so much for being here. Thank you for joining us.
You're very, very welcome. Absolute pleasure to be here. Thank you so much for inviting me. Hello, everyone who's waving. That's lovely. Thank you.
Oh, that's so perfect. Great. So, I guess what birthed the whole of this really was the death of George Floyd. And I know that one of these things that have come up that people sort of say, you know, it had such an incredible triggering effect. And people may wonder why it had a triggering effect in the UK, but it did have a particularly triggering effect. And why now rather than at any other point, when we know that there have been previous deaths in the US as well as the UK. But can I just ask you personally, how did it affect you as a person?
I think the death of George Floyd was horrifying, and as a single moment, it was horrifying. On a personal level, it was almost, I couldn't look. Actually, I have never watched the video, but it was omnipresent and on everyone's lips. And I think people have video cameras, people are being held to account for things because it's you have to believe the sight of your own eyes. And I think that it's very easy not to, you know about these things on an intellectual level, but it's very easy not to think about them. And I admit myself that I have never watched that video, although obviously I knew it was happening, and how long it took, and how horrific it was. I think the difference now is that because these things are widely shared and people have opinions on them and people share those opinions and thought leaders have opinions on these things, it sort of raised something that I know in my community that's been going on for such a long time about death with people in prisons, and it sort of like brought that up. And I think the feelings of people actually knowing about it and saying it's this is terrible, while good, it sort of like brought up a thing, well, this has been happening for years, this is the stuff that I know about. I have people in my family who've been in the criminal justice system. I visited prisons, I've worked in the health service for a very long time, and these things happen. So they're sort of, yes, great that people know about it, but also, yeah, this is my life, and this is my lived experience. This this, I've had calls from the police station. I've been there. I've been to a police station and spoken to a police officer I knew who asked me what I was doing there. And, I've been stopped by the police more times than I should have been, with somebody that's got a clean driving licence. So, that this is my lived experience. And so it brought up all of those emotions. So some of it's anger, some of it's indignation, and, and it's sort of a mixed bag of emotions, really.
Yeah, that's huge. And I think that we talk a lot about the word triggering, that really triggering. I wonder, if we hear that word bandied around a lot, but what does it mean to you? What does it mean? When you say triggered by something, what does that feel like?
So I think so we've had a really recent thing, even since we've organised this event, we had the Euros, I said in the chat. I live in Wembley in northwest London. I live a mile away from Wembley Stadium, and that was a fantastic event for the country. I'm quite old. I was here for the last European Championship that was held in England in 1996 with all my children before. It was a fantastic event, and the whole event was wonderful, and the spirit of the England team, the things they were saying. There were issues around taking the knee. So when we talk about triggering, the whole conversation about whether the England players were going to take the knee or not, whether the manager was right. I think he was a brilliant leader in the way he wrote the letter, the way that they were consistent about it, the way they were supported. The whole team was supported by the FA, and then so that was great. That was wonderful to see, but there was a sense of unease about it, which came to pass that I couldn't even watch the final, and I live a mile away. I sort of was sitting in a darkened room waiting for what's going to happen. I am a football fan. I support Arsenal, and and then we went to penalties, and then what happened, and I knew, and lots of people knew that this was not going to be good, and I knew it was going to be triggering, and the outpouring, the things that happened, the sort of the violence before that affected families. I was hoping hopefully we were going to win, and I was going to be out there celebrating with everybody, but that was not how it was. It was upsetting. It wasn't good, and people were looking for someone to blame. Now, all the stuff that went before that was brilliant. It was really good, but then there's the menace, I suppose, in the back of your head. What if it doesn't go wrong? Why were the 3 people missed? Why were they black? Why did that have to happen? And the things that are triggering are like, when you see somebody murdered, or when you see somebody, you'll think you're waiting for it. You're waiting for that. What's going to happen? What's triggering is sometimes things you hear in the news. What's triggering is that's normal, and that's just affects how you use services, how you interact with people. It's a way of life. I've heard people say that about their religion and stuff like that, but sort of that lived experience is a way of life, and that can be sometimes triggering. And we're talking about the impact on mental health, and that can have an impact on mine and people in my community's mental health.
So I know you sent me slides over before, and in the slides, when I kind of had a read through, and we decided that it was easy to have a conversation really, then go through kind of very rigid sort of slides and things like that. And one of the things that really stood out in one of the slides was you were talking about, that there's these little microaggressions or things that people say that maybe they don't realise what it is that they're saying. Can you talk about a bit about that?
Yeah, I think so. It's when you actually look up the definition of microaggressions, there's no sort of definition of it. It's more like a feeling. I think in the promo video for this, I talked about structural racism. I talked about all sorts of things. I talked about services. I talked about our great institutions, and I talked about you can't pinpoint anything, but it's a feeling. So I would say an example of a microaggression would be why are you always talking about race? This is a very tolerant country. It's better than America. And you should be grateful to be here. And that sort of thing. It's also a nervousness around talking about something quite fundamental to my existence, and sort of like negating it and not wanting to take it on. Now, where that comes from, and there's no intent around it, but the impact of it is sort of feeling othered, feeling that you're not part of, I was born here. I was born in the East Midlands. I've lived here all my life. I've worked since I was 15, so, I'm as English as anybody else, but I don't actually feel I can call myself English. I don't actually, even though I am. So, it's that sort of thing, to have that sort of like conversation, not wanting to bring those things into the conversation even. And so, the things I was talking about, the Euros, that was great, because that was bringing that out there. They were having that conversation. And microaggression is somebody saying, oh, they're playing the race card, even if they're not saying it to me. That is a microaggression. In fact, no one has ever said that to me, but they wouldn't, would they? But sort of like to say that, I think sometimes social media, sometimes some commentators, they can say something and they're sort of overtly aggressive, and it's very slight. It's not overtly racist, whatever that means, but it's noted. And it's thought about. So, it's almost passive aggression. So I think microaggressions, it's an interesting term, but it's sort of like being passive aggressive, but in a racial manner.
And I love what you actually said on that film, where you said, it's not so much about, it's very hard to prove, and it's very hard to prove intent, but the feeling, that was something that really sort of struck me. So feelings and mental health. What can you tell us about the impact of this? Because obviously that's the title. So the impact of this on mental health. What symptoms?
So so my feeling is that we're all leaders in health and wellbeing services, in councils, in health services, in charities, third sector. We're living our lives in our communities, and everyone's doing the best that they can. What I would say around mental health is, we talked in a sort of promo, this is around children, this is around adults, this is around all of the protected characteristics, how they how they experience services, how that feels for them. An example I have is how easy is it to access mental health services? How likely is it that you will be sectioned? How likely is that you'll be given medication? How likely is it that you or your family will touch criminal justice system? How likely is it that you'll be stopped by the police? And and do you have to think about that? Is that something that goes in your head at all, or do you just like, that's not your concern? I saw a film where someone said, I'm a heterosexual woman, so I don't know what it's like to be gay. So I don't even think about what it's like to be gay. Why would I? I'm heterosexual. So, and that's quite a good analogy, is that I don't have to think about that. I don't have to, before gay marriage was legislated, I didn't have to think about whether I could get married in a church or anywhere else. It wasn't a thing on my thing. But so that's the same for, accessing any services legally in schools. I don't have to think about the curriculum. Do I have to think about the curriculum? Yeah, I do. So, what's important, who is legislating and what's important to them, and who does it help? I think so in our services, are we listening to the people using them? Is there a representation of our communities in the leadership positions in our services? So when a person from that community uses your service, that they are reassured. I can tell you that I have, I worked as a nurse. I touched people, but I worked as a manager in the healthcare for a long time. But when I was working on a ward, I know some people were reassured that if I was there, and I felt reassured if they were there. If you go into a police station and you see somebody who looks like you, if you go into a hospital and the consultant looks like you, that's reassuring. And so, do we know what our services are like, what the experiences are for people that don't look like us, that are, do we know? Have we asked them what that's like? And so that's the impact, really. Do we know whether they even use your service? Would they do they trust, we're in COVID-19, when we've got vaccine hesitancy, and, there's lots of different reasons for vaccine hesitancy, but I know in my community, the reasons are different, and it's around whether they trust the health services or not. And that's painful for me, actually, having been born and bred, being a nurse, girl and woman, but, there are reasons for that. And then, so people sometimes say, well, around jobs, well, we advertise these things, but no one applies. And I'm thinking, well, why don't they apply? Is it accessible? Are they encouraged to apply? Or is it, the people in the positions of power and the positions, they don't look like you, and it doesn't look like that it's accessible to you or not. So I think, and those sort of things, knowing that you're not likely to get a job, whether that's the truth or not. So do we know our data around that? Feeling that there's no point in applying because you're not going to get it, that you're going to be stopped by the police. That's not good. That if you've got a nice car, and this has happened to me personally, I've got a very nice car, that you'll be stopped because you've got a nice car and people don't expect you to be driving it. So that sort of thing does have an impact on, and it makes you very angry, and then that might turn into a mental health concern. And then the thing is, that can you access those services? Who's there to support you to do that?
I think when you touched on anger there, I certainly know a fun statistic, which is that air rage, there's more cases of air rage when someone has to walk through first class to get to standard. So I think we are really hardwired for equality, and there's equality and equity kind of argument, but I think we are kind of hardwired for that. And when we don't get it and we're paying our taxes, then yeah, that's going to create anger. You mentioned the word power there. I'd love to swing back to that. Tell us how this all impacts on power dynamics, because it's one thing to not like somebody, but it's another for the power differential.
So racism without the power is just prejudice. And as you're right, we've all got a right to not like whoever we don't want to like. That's fine. The power dynamic is around who's actually making policies, who has got the power, and who's impacted by that power. So I'll give you an example of that. If there's an Equalities Act 2010. It covers 9, I never can remember, 9 or 10 protected characteristics. Most organisations, and definitely most public sector organisations, have to have policies and procedures around that. It's the law. How that law is applied and how those policy and procedures are written and who they're written about will impact on how those policies are enacted. And that's the power. Who has the power? Who writes that? I was a director of a programme director of commissioning in a city, London Borough, and I know that the decisions that I made in a city borough were totally different because of my heritage and where I came from, and the people I talked to. And it was a fantastic CCG actually. They won awards for connecting with their population and asking them what they want, and they also won awards for working with their local communities and their community organisations. So they were really clear around the services they provided would be that the communities would be engaged and would have a say in those services, and it made such a difference. And I would say it's one of the best jobs I ever had, because I was able to use my personal and positional power to make a difference, but also listening to communities. I didn't always get it right, and and since I've left there, I've had to reflect on that. So what was that all about? And and there was definitely something to be done. But the power, if you're designing services, who are you designing it for? I'm a nurse. I know in healthcare, and I know there's some healthcare people here, that there's healthcare services tend to be designed for the people who are delivering them, not necessarily the patients. They're delivered Monday to Friday, 9 to 5 in the main. And if you are a single working mother, you're going to be hard pushed to actually utilise those services. And that example's got nothing to do with race, but that's what I mean.
Talking of not always getting it right. quickly. The difference between white saviour, and I'm laughing, this is clearly, the difference between white saviour and white allyship.
So this is triggering. This is not triggering. It's difficult, isn't it? So, I think, you know, in this kind of work, and the research shows that the people with power need to be part of the solution. Definitely, brilliant quote I heard, which was from a writer who's written about race. It was like, don't ask me why I've not been invited to the party. You need to ask the host, really. So that is around, you know, who's actually got the power there, because who's inviting people to the party. So it's really important that we involve, you know, everybody in the solution around this, because we're not going to get anywhere if we don't do that. But however, I think the key around, you know, doing that with impact, with great intent and impact, is to listen. It is to actually do your homework. Look, you know, come to events like this, say you're all great, you're all wonderful, this is great, and use the internet. Listen to people's stories, ask questions. Think about what's coming up for you. Like, how do you feel about you know, this increased focus on race? You know, what did the Euros mean to you? What was that about? And, you know, why would people feel the way I do as opposed to the way you do? And, you know, how does that translate into the stuff you're doing at work or in your life? And, you know, and how can you help? And how can you help without dominating? How can you empower rather than dominate? So I think the greatest thing you can do, and I always say the greatest gift you can give anybody, is your attention, is to listen. You know, what is it like to access your services? What does it feel like? What's the patient journey? What's the patient experience? And you know, ask that questions. Do you have the right amount of data that you need, both quantitative and qualitative? You know, and they're both really, really important, and you can make decisions based on that. And you know, so hearing a person's story is really effective, and if you hear it more than once, you know, that's data, isn't it, really? And then when people are making decisions, I'll give you an example from where I was talking about where I didn't get it as right as I wanted. I used to work in Hackney. It has a large Orthodox Jewish population, and we worked very closely with Orthodox Jewish population, very, very committed. But this population don't access services because of fears around their history and their heritage. They don't vote. They don't participate in state schools. They home educate. They self-educate. They've got different ideas around men and women, how they should act and what do. They don't partake in mainstream media. That's a whole different tip. And we really struggled to actually give them the services that they wanted to, and they told us the services they wanted to. And you know, and I can't say hand and heart I got that right all of the time, but I did represent those views. But it wasn't just up to me. And you know, could I have pushed harder? And when I actually had the choices to make those decisions, did I make the choice that was in their interest or in mine? So you know, that's the sort of thing that you need to think about, because you know, I did have the data. I did know what they wanted. So, and I would say when asked, and did they get what they wanted? They would say no. So, you know, that's because we delivered our services in a very traditional way that didn't really reflect. However, I did work in a different service, which was around continuing care for children, and you know, we did a thing which was around personal health budgets, and we were able to get it right, and I was really proud of that because it was based around their family needs and not a hospital's needs. So you know, it goes both ways, but it was a great lesson for me.
Fantastic. Now I've started to see that we've got questions that have been coming into the chat, so I think it's enough of me. So if you have a question, just please put up your hand and just so that we know to come to you. I'm going to just change this to view so that we can see everybody. There we go. So it will help if your camera's on, but if you don't want to put your camera on, then there is actually an icon that you can press now. If your question is something that you don't want to say, you know, you'd like to do it anonymously, then do just put it to me privately in the chat. My name's Becky Walsh, and if you click on my face, sounds weird, 3 dots will come up, and then you can privately message me on the chat that way, and I will read out your question without exposing your name. So anyone who wants to ask a question of Dawn, then please raise your hand either as an icon or a physical hand, and we will come to you. And then we will go over to see if there's any questions from Matt on the Facebook page and any comments that have come in on Facebook. So, any thoughts, questions as I go through my screen? I can't see any questions that are coming across yet. Where are we? No, so there was a question that I believe I saw flash up. Let me go into the chat. So there was a question here. I won't. It's Dion. So I don't know, Dion, if you wanted to speak a question. If you do, just unmute. Otherwise, I'll read it out. But it might be helpful to get a bit more context of the question, because you've said a collaborative approach, working alongside people you're trying to help. So I wondered if you could speak more on that. And,
yeah, it was just a comment on the back of the. Hello, Dawn. Nice to meet you.
Nice to meet you too.
Yeah, it was just a comment basically on the back of the statement that was made about white saviour versus white allyship. And yeah, so I'm not sure. I kind of meant it as a statement, but I suppose it can be a question that I think maybe when it's all done, like you said, by the people in power, with the best intentions sometimes and with good intentions, but not really asking the questions for the community that you're trying to help or listening to their needs. How much work do you think we have still got to do in terms of being able to successfully have a healthy collaborative approach between the communities that we're trying to help and alongside the people in power, I guess, and our white allies? Do you think that we're on the right road to that, or yeah, what's your experience of that collaborative approach? Does it happen?
It can happen. I have seen it happen, but I've also seen it not necessarily happen. So a collaborative approach. So I'm going to give you a really good example of allyship. So this event is a really good example of allyship. Something designed to hear people's views, something that was co-designed and thinking about the right approach. And you guys can tell us whether this is the right approach or not, to have a conversation rather than a lecture, to sort of like talk about experiences and feelings rather than talk about legislation and what should be happening, and to hear people's views and where they're coming from, to get people across in the health economy, in the health and wellbeing economy, to be here. I would say that an anti-racism pledge, and there's a difference between an anti-racism pledge and an equal inclusion pledge, or even equality pledge. It's quite deliberate and very, very welcome, and to have conversations like they've been having in Weston-super-Mare Council with different people in the community is fantastic to do. And also to be really clear about what your intention is. So, you know, all public sector organisations have to have an equality sort of policy, a diversity policy. I always say, because I used to look at people's policies, and I was saying, so what's the point of this policy? What are you trying to do, and how do you know it's successful? So in any of the things that you're doing, it's really important to know what does success look like, both for the organisation and for you as a leader, but also for the people who are experiencing that policy or that initiative. So so I'm going to use Weston-super-Mare as an example. So it's fantastic to have an anti-racism pledge. What do you do with that anti-racism pledge? So what you've decided to do is to have these events, to talk to people, to have those things, and at the end, I guess it's around so people will feel that something's being done. So what I hear, and I do focus groups with organisations. I also work with Black staff networks. is if people feel that nothing's happening. So not only does justice need to be done, justice needs to be seen to be done. There needs to be an outcome, and something needs to be different, and something needs to be demonstrated. So does that answer your question, Dion? Bless you.
that mute button's a tricky fish.
I have an awful mouse, and it takes me like 5 minutes to get to the mute button. But yes, no, that was very useful. Thank you so much, Dawn.
You're very welcome. You're very welcome. I saw somebody with it was either a thumbs up or a hand up. I'm not sure.
Let me change speaker. I know Catherine. Yeah, Councillor
Yeah.
Gibbons. Hello.
Let me, have I unmuted?
Hello.
Hi.
Hi. I just wanted to ask a question about mental health and children, because obviously it's a huge issue with the pandemic and the role I hold in North Somerset as exec member for Children's Services. It's something very important. And I have noticed that I'm hearing of more and more occasions where race or even xenophobia is playing a role in children's attitude to sometimes. I know because I live this with my son. We're a mixed family, and he has a very difficult surname, which people would pretend not to be able to pronounce and pronounce it. And I know he went through a lot of stress and anxiety when he was younger. And I'm thinking that, and I'm seeing like this, and yet believes that perhaps
I don't know if it's just me, Catherine, but you keep breaking up a little bit. Okay, it's not just me, that's good. So you might need to be a little bit more directional to the computer, because sometimes Zoom does that.
Yeah, sorry. I'm saying I'm noticing that more and more families are experiencing a few problems like, and I'm just wondering what advice you have for us as unity leaders, counsellors, and interested people. What more can we say to the schools to this and make sure that they can support any children that might face kind of anxiety?
Okay, so what I heard, because you were breaking up a little bit, but I think what I heard, and you can tell me if I'm right, is that you've noticed, particularly post-pandemic, that there's more issues in the schools, and around race, and what you're asking is how you can support schools with that. So I think the council with the anti-racism pledge is brilliant, and also that to have the leaders of the council have events like this is also brilliant. To translate that into the schools is to be really committed about it and saying that this is the work that we're doing, and as we're working with the schools, this is part of our work as the council. So what I think is then it's really important to have the conversation like we're having today about how that feels in the schools. So what I've heard from people, that people feel ill-equipped to deal with that sort of thing, particularly if there's a majority population, and these things are quite difficult to talk about, and to have a conversation about how that makes you feel, and to talk about coping strategies. So school's really, really important. I grew up in Loughborough in Leicestershire in the 70s, when I was the only black girl in the school at 5, and I was doing some work. I'm doing some work tomorrow with an organisation, and one of the questions is when did you first become aware of your race? And then I said to the person I'm working with, I can't remember. And she said, when I went to school. And then I thought, yeah, that's because before that, race was not an issue because everybody looked like me, and that was normal. And then when you go to school, then you're aware that that's an issue. And I'm children's nurse, by the way. So, children, if you talk to a 3-year-old, they don't, I hate this expression, they don't see race. So I'll have it for a 3-year-old, but I won't have it anywhere else. They're not interested in race. they just go see another person and they learn these things. So school's very, very important. So my answer to your question is, if it's important to the council, then it needs to be important in schools. That leadership needs to come from the top, but that leadership also needs support around that for how people deal with those situations. So a thing I found very useful is around role play. You know, what's that like for that child? Because the research says that people from my community that are in an education setting where they're not the majority population, they can have some issues in school, and that does impact on their behaviour and or their perceived behaviour and how things are seen, and then that affects their school journey, and that goes on to school attainment. You know, what they do, what jobs they take, how far they go into education, do they touch the criminal justice system? It goes on and on and on. And I think most people are familiar. There are things like family nurse partnership and stuff like that are talking about babies and young mothers. So that's where it starts. And also I would think about, sort of like, I think about how teachers are supported, how the children are supported, and also, what work's been done in early years, etc., and keep people in school as long as possible. There you go.
Great. So we won't go back to Karen just in case she can't. Great, lovely. I think also as well, something that I've heard a lot about is around representation around teachers in school as well. So that's a big deal too.
Yeah, it's around leadership, and if you haven't got that representation, it's difficult to recruit to schools. It's difficult to recruit to in health services. It's around what the support is there to have these conversations about. So what's that like? I was talking earlier about what does a service, education as a service. So what does that feel like for your clients, your children, and what is that like for people using it? The people who may be struggling. So I'm not going to say that it means you're going to struggle, but if people are struggling, what's the data around that? What could be behind it, and what support services are available? And we're all working with a reduced financial envelope for whatever reason. So it's around how important that is to this council, your services, or whatever. And I've had a fantastic experiences working with third sector organisations and voluntary organisations around this. Those people can help you with this, so I would reach out to them.
Thank you so much. So we've had a message has come into me directly. So it says there is a significant clinical and behavioural research. There is significant clinical and behavioural research being conducted on a phenomenon of inherited trauma and its effects within the Black, African and Caribbean communities. What are your thoughts of experiences about this in the context of general mental health of contemporary African and Caribbean communities?
I think that is true, and I'm really glad that they're researching it. And even if the research doesn't bear that out, it feels true. And I think as a person who's been trained in the medical model, the experiences that I have and that my friends and my family have, that it's not just me who has them. And there are things around that a lot of mental health. There's not that much research in mental health and the experiences of particular communities, and that's always an issue because you can't disprove it until you've done the research, and it's very difficult to get people to actually be part of the research. I've seen that hesitancy. I felt that hesitancy myself. So it's quite exposing. We've talked about triggering. So I'm glad they're doing the research. I think there's a lot of work to do with people from my community, which is a West Indian, it's very traditional way of saying it, African Caribbean communities, to be part of that, to be part of research, to trust people to actually expose that. I'll give you an example. I was asked to be part of a film that was being done by a university, and to talk about racism, or the impact of COVID-19 on nurses, and whether there was racism involved in that. I felt I could not take part in that film, because I would break down and I would cry, and people would know around that. So I think, and that is very traumatic, and the way I managed that, and where people didn't really take that on, was also very traumatic. So that experience is real, and so and it has an impact. So I now feel I don't work in the NHS anymore, and I have my own business, and I do this kind of work because it's a passion project. I think it's really important, but I wouldn't want to work in the NHS, which is it's a shame for the NHS, really, but that's the way it is.
Makes sense, thank you. So another direct message that has come in. Sorry. If you don't have a hand raise option, just put your hand up, like literally. Yes. As long as you've got your video, just put your hand up. That's fine. So I just realised that because somebody who made the question said, I would have spoken it out loud. So just put your hand up. But I will just quickly read this one, another direct message that's come in. Based on life experiences prior to 2020 events, what are your views on how society have been towards this topic area, and have you ever felt that these views are sometimes normalised or stereotyped in everyday life, thus affecting mental health? How do you overcome these moments, and any recommendations to support BME community members?
Okay, that's okay. So I think that the terrible events around George Floyd, I think the hideousness of COVID-19 has shone a light on things, and that we're now in the internet age where that can be spoken about. We have I love social media. You can tell that I don't mind talking, and it's given an opportunity for these things to be spoken about. I think if I remember what the question comment was, do I think that's been normalised? I think it's scary stuff, and there is people try to make it normal, to make sense of the world, and there's lots of reasons why people behave the way they do, and my method of coping, my coping strategy is to do this kind of work, to sort of let's work with organisations, let's work with people with power, let's work with people who are actually devising policies to sort of see if we can change. So I take my power where I can. On a personal level, so I do that through my work. On a personal level, I work with charities, and I work with an adoption charity as a trustee, and I work with my community in different ways. I support Black businesses, and I mentor people around that thing, and my thing is around talking around that. So that's my encouragement for the sort of Black and minority ethnic communities. Get involved with charities, speak your truth, take your opportunities to speak truth to power, and to represent your experience. So local authorities, councils, schools, they're places with people in power. Join the Parent Teachers Association, do what you can, get involved, and use your influence where you can. This is how I choose to use my influence, and everyone has their personal power. And I would say to anybody who feels strongly about that, think about where your personal power is and where you can make a difference, even if it's with your family and your friends.
Thank you. We will be heading over to Matt, who's our Facebook correspondent, in a moment to find out live what's been going on Facebook. But in the meantime, if you've got a question, do please raise your hand. And whilst you're raising your hand and finding your unmute button, I'm just going to quickly ask this one that's come in. It says, Dawn mentioned systemic change needing to happen from the top down. What can you do as people... what can you do as people with less power in an organisation when change needs to be driven from the bottom up?
I think it comes both ways. So I hope I didn't give the impression it should just be top down. It also needs to be bottom up and meet somewhere in the middle around that. And what I was just saying around finding your power, finding those organisations that finding like-minded people, using your influence in a positive way, looking at your own organisation where you work, your own community, and that's how I think change happens. I'm going to use the football analogy again, is that Gareth Southgate used his personal and positional power to make a change, to make it, he normalised taking the knee, which was an amazing thing to do because he was taking on the government, and whatever your political flavour is, that is an example of how you can create a movement for change and for things to happen differently, whether you agree with it or not. It was very, very successful. So that's the sort of thing that people need to be thinking about. What can I do differently? Is it being supportive? Is it listening? Is it hearing people's truth regardless of how I feel about it, and to sort of being consistent around that? So and I go back to, if you feel powerless, look for your power, look where you do have influence, because that sometimes, and I think if you have got power, listen to the little people, listen to the people that they're the people who were telling me what it's like on the ground. I was in a senior position, and it's really, really important to not be in your ivory tower, as I call it, whether you're in a hospital or in a big organisation. So, keeping your ear to the ground, or keeping it real, as I would say, with people that are real.
Wonderful stuff. Questions? Anyone got any questions? Please raise your hand. I shall flick through the pages. A few smiles.
I'm really impressed that we've still got all our participants. I think we actually got more since we started, so good on you all. I'm very, very impressed.
And a wonderful job from my Molly, Molly, who is manning that for me whilst we're having a conversation. Okay,
is there a question from, is it Gareth?
Oh, good. Gareth, would you like to unmute yourself if that was you? Oh.
You can see your ceiling, Gareth.
You are unmuted, I think, so speak away. There you are. Hello.
Hi, Gareth.
Not so much a question, I guess, as a bit of a statement. I was just thinking, listening to the conversations about the inequalities.
Yeah.
The recent circumstances we find ourselves in. I had a chat with an old school friend who's a secondary school teacher in the London Borough. And she was telling me that she felt throughout a consistent pressure to be in work every day, and she lives in an area which is perhaps a little bit more colourful and diverse and inclusive than North Somerset. It seemed to be a pressure that was unavoidable to be in every day, and it kind of made me think and reflect a bit that actually I've been really lucky that I work for an organisation that had adopted agile working before this came along.
Yeah.
And my employer has afforded us a lot of freedom to work in any way that suits us best. But I do see clients coming through my that don't have that option through income inequalities.
Yeah.
It can't not work, and the pressure to work seems to be undue and unfair. And we hear about governments talking about levelling up, but depending on where you sit in society, your opportunity to level up is somewhat limited.
Yeah, you're absolutely right. You're absolutely right. So when the pandemic started, I worked for NHS England, and I worked in an office in central London, and but I had the ability to work at home, so I had that privilege. So I wasn't working in the front line, and I was able to I was asked to work on the front line, and I actually refused, and I had the privilege to refuse because I knew that as my race made me more at risk, and I said that I'm not going to do do that, and they just had to accept it because I wasn't going to do it. And I had the privilege to be able to do that, and I realised that I had the privilege to be able to do that. So I have this expression called Joanna Normal. Joanna Normal nurse did not have that right to do that. She would have had to go into work, and she would have had to work even if she felt unwell, and particularly if she was an agency nurse, which people from our community are more likely to be. There would have been consequences for not working, around not being paid, and for housing. There would also have been consequences around whether her children could go to school, around childcare, around all that sort of thing, and that is around the impact, and that would cause stress. And going to work, even now with the pandemic, people are under pressure to go into work, aren't they, really, whether they've had contacts or not. And people like me can say, well, I won't go out the house, then I'll stay here, that's fine, I can work online. But that's not everyone's privilege to be able to do that. And I think as employers, as neighbours, we need to be thinking about, what's the reality. It's a bit like, so let's take it away from race, it's a bit like the flexible hours thing for working mothers, or school, designing services around school holidays. It's that sort of thing. And sort of like COVID-19 sort of like joint there, how fair are those policies? How fair? I know we've got to keep the country going and everything, but those kind of policies have a massive impact on families, on education. The lockdown affected schooling, and people being back in school makes infections go up. What is that like, and how do people cope with that, and how do they manage it, and who's making the rules, and who do they help?
Wonderful. Thank you very much for that statement, Gav. Matthew, who is on the call somewhere, I can find him in a second. Matt, can you unmute yourself and let us know what it is that's going on Facebook? Thoughts, comments, questions that may have come in. I'm handing over to you.
Oh, hello, everybody. Thank you massively for joining us this evening, and hello to Dawn. Hi, Dawn.
Hello,
It's been incredible to listen to you this evening, and our Facebook audience is saying the exact same thing.
Oh, brilliant. That's really good to know.
So one thing that I did want to draw everybody's attention to, we have the lovely Alex, who is joining us on Facebook, and she is from an organisation called Stand Against Racism and Inequality. I attended one of her talks the other day, and it was incredibly powerful. But if anybody here on the Zoom call did want to have a look at any good links that may be able to sort of support what Dawn's been saying this evening, I would definitely recommend catching this again on the Weston Town Council Facebook page, going through the comments and having a look at those links, because
absolutely,
they are a fantastic organisation to get in touch with. As well as Helen, who runs a volunteer tutoring organisation called the Atami Tutoring Centre, and they focus on trying to bridge that gap in inequality in education, which is something that we've spoken about.
Yeah, we have spoken about that. How useful is that? That's wonderful.
Absolutely. Which I'll do a lovely little segue into this question for you, Dawn, if you don't mind. This one comes from Simone. And they would like to know, what can schools do to help attract more Black men into education? Oh,
I wish I knew the answer to that. This is irrelevant. My ex-husband is a primary school teacher, and the way he got into teaching was by having to take my son, my now 25-year-old son, to nursery, and spending time with nursery workers and seeing. And he used to work for a council. He used to work for a council in London, and the nursery was the council's nursery. And he spent time with people in the nursery. And actually, he wanted to be a nursery nurse. He was thinking about being a nursery nurse. And I said to him, well, why don't you be a teacher? And he retrained as a teacher from that. And he still is a teacher around that. So the lessons from that are that it's around and he was very highly welcomed as a man and teacher, working with from the 3-year-olds to 11-year-olds, and Ali sought after, but he had to train for nearly 7 years to do it. So I would say that it's around making that seem like an attractive option and also to make it easy to do. So my ex-husband had to leave his job and do a part-time access course and then do 4 years in university, which at a cost of a lot of money. And I think there are schemes, and we do this in nursing as well, around how do we get people into nursing, is around making doing apprenticeships, making it as easy as possible for people who would like to do that, to be able to do it more easily. I would target black men, and being primary school teachers. If it was up to me, I would look at people that are working as youth workers and who are working with young people, and around whether they'd considered a career in education, and I would incentivise them to do it, because I think it would be a good thing to do.
Thank you so much for Dawn. I think that's a lot to think on with that one, and the idea of incentivizing communities is incredibly powerful.
Yeah.
And I think something that will resonate with some of the audience that we have here, both on Zoom but also over on Facebook. And does, again, the segue fish is in action this evening, because this next question comes around community and making people feel safe. Now, Maria has asked, what do you think that people could do to make people feel more safe in their community, school, and just their general surroundings? And I think Maria wanted to know a little bit more about whether or not you've had that conversation of race with a child or a close relative as well.
So we talked a little bit about education before with Catherine, and I think there's a term called psychologically safe, and this just doesn't apply in schools, it applies in all institutions and organisations. So the reason people don't feel comfortable, the reason I wouldn't feel comfortable talking about issues around race is that there's sort of like, you sort of get this sort of sixth spidey sense that people don't want to talk about it, and it makes people feel uncomfortable, and so you don't, and you might talk about it with people in your community, or you might not, or you might just not go there. So to be psychologically safe is to feel that your opinion is valued and that people want to hear it. So you have to create that environment where talking and sort of like feeding back, speaking the truth, and people asking people's opinions about, I talked earlier about how does that feel for you, what matters to you, how is this for you, how is this so say, for example, I could say to I don't know, David, how's this conversation for you? How do you feel about it? How did it make you feel? Did you feel you could speak up? Did you feel that you could say what you wanted to say? Did you feel that that there would be any repercussions for that? Did you feel that would affect you? And if the answer is no, then a little bit of investigation into why that would be. So that might be because, as I said earlier, people don't feel equipped to have those conversations. So if that's the truth, and but we can only find out by asking, then people need to be supported to have those kind of conversations. If that's an issue in your school, in your workplace, in your HR department, wherever, and I have heard that. I have heard that we can't have a discussion about race because my HR department can't cope with it. And then so my answer to that would be, how can we help your HR department to cope with having conversations about race rather than not having a conversation? So I would ask, how would people feel safe? What would make people feel safe to speak? And whatever the answer is, what the intervention needs to be.
An amazing answer, Dawn. Thank you ever so much for that. And again, that's got to be hitting home to quite a few people here on the Zoom call, and again over on Facebook. And does tie into a final question that I have from Samantha. And I don't know if Dawn, you'll be able to shed some more light on this, but how would organisations such as our own organisation that's hosting this event today what would you say is the top hints that you would give to be able to turn allyship into a cultural change that helps affect attitudes and progression within an organisation?
So I think this is a great start. It's having the conversation, and Gareth Southgate's ears must be burning. So he's a great. So my example is he's a great role model, and he's a role model with people that might have opinions that I don't like and that I would find unsafe. So he's a really great role model for those opinions. The reason I say that is the leadership of any organisation, if all of the leaders, and this anti-racism pledge was passed unanimously, so that shows a commitment to anti-racism. If the leaders of an organisation show commitment to anything, people who want to get on in that organisation will use their sense and change their behaviours to please the leaders of the organisation. And if that is if that's a non-negotiable, people will fall in line. It's just pure psychology really around that. So it's around having those conversations, what people might be struggling with, and how can we support them to do that, to have representation of what experiences for your services are like. What's it like to work at Weston-super-Mare Town Council? What's it like to experience the services? What's it like to go to school in Weston-super-Mare? What's it like to be involved with the police in Weston-super-Mare? What's it like do you have to leave Weston-super-Mare to fulfil your ambition? And what is that about? So I will tell you, I live in Loughborough in Leicestershire. I left 3 weeks after my 18th birthday because that was not the place that I was going to spend the rest of my life for maybe obvious reasons. But that. And if that was a nursing situation, if people are leaving, why are they leaving? Where are they going and for what reason? And then you find your answers about what you need to do differently.
Yeah, I think that conversation of communication is so important within organisations. And
commitment from the leadership, I think, is also really important, because I think to make change happen, you need to have commitment from leaders at the top, and then you need to have sustained action around actually what is going to be different because of this commitment.
Absolutely, and I think the town council's commitment to be an anti-racist council is such a positive step forward.
Absolutely.
And having events like this, as you've said, Dawn, is just an incredible way to show our commitments, both professionally and, in my case, definitely personally as well. So thank you, Dawn. That wraps me up from Facebook. However, if anybody does have any other questions they want to drop in the comments on Facebook, I'm not going to stop monitoring it just because I've stopped talking. So do keep your comments coming in.
So I saw some comments around, I've looked at them briefly. I can't, because I try not to look at them because they're very distracting. But I saw some comments around language. I also had some comments around mixed race children. So I think language is a thing that people really, really struggle with. People don't want to say the wrong thing. People object to acronyms, and some people do, some people don't. My advice is, if you're unsure, ask how people want to be described. When we look at the transgender debate, that's not my lived experience, but what I see is that people have decided how they want to be described, and you have to respect that. So I would say have those conversations around that. Nobody's going to say to you, this is the term now, we're using this term. That's not going to happen. A conversation needs to happen about what people feel comfortable with and what people don't feel comfortable with, and that evolves as time goes on. I saw a comment around mixed race children. My children are mixed race, and what I know is that their experience is totally different to my experience. I will say that I live in a very multicultural. It's actually got a ethnic majority where I live in Wembley, and their experience of education has been very, very different to mine. That's not to say that they don't have issues around identity and heritage, because they come from I'm a single parent and their dad lives abroad, and but we've got a really good, relationship between both of our families with mutual respect and stuff like that. But that, again, is not to say that they don't have, but I think the key is around talking around things. And if you're not seeing those role models, to seek them out. There are lots of books, there are lots of programs, there's lots of representation, and I'm going to say something that's going to sound really, really silly. I used to watch Big Brother with my daughter, my now 20-year-old daughter, and we used to talk about, so what's going on here? Is that domestic violence? Is that is that appropriate behaviour? Is that how you should treat a woman? Is that and I used things on the telly, what I saw or what I didn't see, to have sort of like teaching moments with my daughter. So I would recommend sort of seeking that out. Use the internet, use social media. It's fantastic. There you go.
That is genius. I love that. Leon, I had a little note saying that you had your hand up earlier, so I don't know if you wanted to say something or speak. So just swing it back if you do. David, I think we've covered your question there, David Crossman, but you also made a very good stat point. I'd very much welcome you to unmute yourself and mention that if you want to. Otherwise, people are going to have to put up with my reading, which sometimes sounds like a 3-year-old.
It's on route from me then. Just be interested in Dawn's views on the use of acronyms, and I suppose in the mental health point of view, the problems that can be caused by labels.
Yeah. So from a mental health point of view, I can tell you from experience in my family that there is a reluctance to access mental health services for fear of being labelled, whether that is true or not. And there's a reluctance to take medication for the same reason. There's a reluctance to be involved at all in mental health services, and that is cultural. That's my personal family experience. I'm not sure, I'm going to be totally honest with you, what the answer is to that, because that's around trust of institution, that's around personal lived experience. I've had somebody in my family who was institutionalised in a mental health hospital for 30 years, and they eventually came out in what was called care in the community, and they died in their 50s. So I've seen how that works. I've seen that how that works. So, I'm not saying that I feel that way. I would advocate for anyone to get support around their mental health, but I totally recognise why people would struggle to do that. I think we need to see examples of when health services are used well, and those examples need to be out there. I think there's a story on EastEnders at the moment around schizophrenia and a black man. It's not the most positive of stories, I'm going to be honest with you. So I'm not sure how helpful that is, but it would be good to see somebody represented in mainstream media that had a serious mental illness but was managing it. And how that went. That would be probably more reassuring to see some of the things that happen. I also think, it's a personal opinion, that some of the people who are in prison are actually mentally ill and that they need help and support, not incarceration. That's a personal point of view. But that's my lived experience of people I know, and I know that there's a fear of social services, there's a fear of the police, and not wanting to be involved with it, and that is personal. I alluded to, I'm 54 years old. I've been stopped by the police 7 times, and I've got a very clean driving licence. And so, what is that about? Most people I know have never been stopped by the police. So so that affects my attitude to police officers, and whether that's right or wrong. So it's around how things are representative, what that feels like to people, what people hear is happening, and how they act. And so there's a lot of work to be done, a lot of conversations, a lot of representation that needs to be done so people feel that they're safe. So, and I know that labelling, and it's not just around heritage, it's also around, I have ADHD, but I didn't find out till I was 50. So, that's a bit of a thing. isn't it, really, that affects your mental health? But do people believe that a 50-year-old woman's got ADHD? That's what young boys have, isn't it? So, you know, that's that's what it's all around that. So I haven't got an answer, David, but I hear your question.
Gemma Bigwell, you've put plenty of comments. I was wondering, I wanted to invite you to see if you would like to unmute and ask your question. If not, I will ask it for you, but it would be great if you would be happy to do so. Not unmute from Gemma, so I will read it on her behalf.
Okay.
Okay. So,
yeah, if you could, only because I can't do the chat and thing at the same time. Sorry,
okay.
Other people's questions.
Great. Yes. No. That's absolutely. Do you want to ask while you're unmuted the comment that you made?
Yeah, I think I'll be able to. Bear with me.
You're right, Gemma. I think Gemma was saying she couldn't coordinate the everything.
I think I've got it now.
Okay, brilliant.
So the first question from someone in the community was, although there is a massive stigma to be inclusive and diverse,
yeah,
we have to level ourselves with what is now the new normal. 10 to 15 years ago is when we had abnormalities. Now we have so many pressures and strong passions in all racism and gender debates, and when we level out and everybody be treated the same. And I will go on to the next one.
Oh, can we pause there so she can answer?
Oh, yeah, absolutely.
That'd be great. If she's got brain like mine, she'll forget the first question by the time.
I will forget the first question. So this is very interesting. I've worked with an organisation where one of the issues, and the reason I worked with them was to support people who were disproportionately affected by COVID-19 and working. I think somebody alluded to sort of like the fairness around that. I think it was Gareth earlier. So my role was supporting people who had been disproportionately affected. So I'm going to put disproportionately affected in inverted commas, because for me, it's not saying that people aren't affected by everything. It's not, for me, it's not about saying that, you know, there's issues around gender, there's issues around trans, there's issues around homosexuality. Of course there is. Everyone has been affected by COVID-19. It's been, you know, unprecedented. I've never said the word unprecedented so many times in a year ever. For me, the work that I do is around disproportionality and the impact that has on services. That's why that's important, and that's a hill I will die on. So, you know, that, you know, I will, you know, I'm going to say I'm anti-racist, and this is the work that I do. That work is based on my lived experience and research. And that's not to say that the other things aren't important. So that's my answer to that sort of question. I don't really like the word levelling because we're in an equal system. So it's never going to be level unless we address some of the systemic things that need to be addressed. What was the next question? Gemma, are you still there?
I am. Thank you so much for answering that for me. The next one I had was about the dynamics in schools and the need to change to be able to make racism, mental health, gender and all the other issues a standard part of the curriculum. It's a very big part of well-being, not only in the curriculum, but alongside that too.
Yeah, so that's absolutely right. We have an Equalities Act 2010 and we have equality impacts that organisations put strategy that have to So as I was saying before, it's about how important it is to the organisation, you know, and what they're going to do about it. So everyone's got a policy, everyone's got to report on these things contractually as part of the what does that mean and what does that look like in practice. And one of the questions we were thinking about is like, you know, everyone's got a diversity policy and everyone has got a diversity policy. And my question for people is, what does that mean and who does that help? And, you know, how do you know that you've made a difference with that policy? And how do you know you have made a difference compliance with that policy. What does that, so having a policy, does that mean that everything's cool in your organisation, or is it there's still some work to do, and people need to have questions and ask questions, talk about it, and have an action plan around that, then to be able to demonstrate they've made any difference. So I would say go back to leaders need to go back, and representatives need to represent around what that actually means in that organisation.
Thank you. Again, these are just questions I've had myself.
Yes, Gemma, yeah.
It's not my own.
I hear you.
Yeah, and I just think it's really important to obviously highlight that there are parents out there that believe in a lot of things, and they may not be represented in their school, whether they feel that they need more or less, or sometimes I believe if you speak up, it's not always welcomed.
Yeah, and we talked about psychological safety, and it's the importance of the leaders of organisations to recognise that it's difficult for people to speak. One of the things that I think is really important in an organisation as a leader is not only to listen to people who are talking, it's also to listen to people who aren't talking and why aren't they talking. So, to do an analysis of, who is represented, who has got a voice and who hasn't, because it's the underrepresented voices that we might be missing. And there is a job as public service leaders to actually find out that feedback and to go back on it. We all have personal responsibility, and if people can't do that, how can we support them to be able to do that, is the question we should be asking ourselves.
Thank you, Gemma, for your comments there. I think they were really powerful. You really added something to that whole conversation. Thank you ever so much. So as we're starting to wind up our time together, last questions. What are you going to lay in bed tonight and wish that you'd asked Dawn when you had the opportunity? So if you can raise your hand.
These questions are good, man. I've had to think.
So what did you say, Dawn?
I said, these questions are good. I've had to think.
Yes, we have an intelligent crowd here in Weston-super-Mare.
Absolutely.
And in actual fact, we've had lots of people. We had interest from people in Canada to join this. So we've had international interest all over the place to actually be taking part in the course. So that's rather exciting. So
fantastic.
Icons up, thumbs up. Any questions, any thoughts from the panel? I'm going to double check.
I can see Ian with his hand up. He can't deny it. It's definitely happening.
Definitely happening.
Sorry, I have. Is it okay, Becky, if I ask two very short questions?
Absolutely, yes, for sure.
Just picking up on the inherited trauma and thinking about the way in which Black people are treated in the mental health sector. What is your experience, and how do you feel the National Health Service, or indeed anything related to psychiatric and those sectors, how do you feel they function as far as cultural responsiveness?
So I think,
in other words, the whole idea of people who are like the people who are being treated, people who understand the psychology, people who understand the language, the behaviors, all of that context.
I think it is really, really difficult. I think there is real good intent. I think my personal experience, it's not there. And I'm going to give you a couple of examples. I spoke earlier about having a family member that did not want to attend mental health services, even though, in my opinion, and it was a professional and clinical opinion, they were having a crisis, and it took some time to convince that person to actually access services, and it was an emergency, but that person needed to use his family and the community and a religious community to support that person in accessing services, and the support that they are getting following accessing services is not within the NHS. So the NHS is under-resourced, and it's very difficult to access mental health services. And it was bad before; it's even worse now. And people can't access primary care services even to get into services. So that's where we are. I think the answer. There are a lot of people from my community in mental health services working away there, but I can tell you, and I know this because I've worked with them, that they are struggling with being heard themselves and to work effectively. And they, I worked in an organisation where the effects around things that we've talked about, sort of being present at work, the impact on families was very, very great, and people have been struggling to articulate that within any bureaucratic system. I think that's an issue. The answers are the same as they are for everything. It's around having those conversations, speaking truth to power, actually representing staff voices and patient voices, and going back, I'm going to say what is it like to be an employee in a mental health organisation? What is it like to be a patient of a mental health organisation? Is that easy? Do people access services? Do people the key performance indicators that we have, are they appropriate for a start? Because they're around going to work, and stuff like that. Are people going to be honest about how they're feeling and how they're coping because they trust the services? So we need to think about our measures and whether they're appropriate. And the only way we're going to be able to do that is to be able to ask the people who are using the services and to get representation around that, and the actual people who work in the organisations. And use the data around who is in A&Es, who is there in the middle of the night. There's drugs, there's alcohol, there's all sorts of things that are related to mental health, and who are using those services, who's not using those services, and where are they leaking, for want of a better word, where are they going? I've spoken before about community services, and they need to be recognised in how they are mopping up mental health services that cannot be provided in traditional healthcare organisations. And I think, and that's where local government comes in, that's where integrated care area systems also come in. So if we can't provide those services in traditional ways that aren't being provided that well anyway, how else can we do that? Can we do that through social prescribing? Can we do that in other ways? Where are people going? Do we need to do in churches, community organisations, schools? Where do we need to do that? So I think I always talk about in Brent, I've got a friend who works around accessing black men, around healthcare, and they go to barbershops because that's where the men are. For Muslim men, they go to, ironically, they go to betting shops, but they've all been closed during lockdown. So, you need to think about where people are and where they talk to and who they will talk to. They're not going to talk to me, but they might talk to an imam, they might talk to another black man. And if we're not being able to get those people, why can't we get them? My constant question is, oh no, we can't do that because. And my question is why. I hope that's helpful, Ian.
No, thank you very much indeed, and indeed thank you for the whole evening.
You're welcome.
Great. So I'm just going to do a double check and a quick whip round to see if there's anybody that we have missed. I'm getting some really lovely comments coming in, Dawn. So
yeah, I could see them actually.
Yeah, you're seeing them coming in. I will send those to you afterwards. You can stick them on the fridge. We've got some lovely ones coming in on Facebook as well. So that's been great. So a final call for questions before we thank Dawn and wish her a good evening.
May I interject just for a brief moment?
You may.
Thank you very much. Just wanted to say a big thank you to everybody who has watched the stream live on Facebook this evening. Thank you ever so much. And just to reiterate to everybody here on the Zoom, if you do want to catch up with some of those more detailed links and some more of that information, do go onto the Town Council Facebook page after this stream has finished, so you can go and have a little look through, click on those links and learn a little bit more. And a big thank you from myself to Dawn. It has been an absolutely incredible evening. Thank you ever so much. And I think it's going to be a big stepping stone to enable organisations to look at this as more than just a tick box exercise. Absolutely. I think we've got some real positive steps forward. So thank you, Dawn. And thank you to our lovely, ever so passionate Facebook audience. Hand back over to Becky. Thank you very much.
I'm ticking the mic. Yes, absolutely concur with everything that's been said there. The last Tuesday of every month is when we have our anti-racist group meeting. At the moment, we have got the Multicultural Society, the Polish community, the Bangladeshi community, the BAME network. Have I covered everybody? But there is always a seat in the house for your organisation, I'm sure. So we're going to be looking at how we can expand this and continue to do more work. And dare I say, maybe one day we could actually call Weston-super-Mare an anti-racist town. Who knows? Ian, put up your hand. Did I forget?
It's just that you were going to ask one last question of Dawn.
I'm skipping that question.
Okay, fair enough.
But I can if you like. So Ian wanted to ask, what was it like to meet Michael Jackson?
Well, you know what? I'm going to be honest with you. So this was in 1991, and I was working as a nurse, and he was visiting someone in the ward I was working next to, and I ran in, and so what we would now call paparazzi were outside, and I goes, "Do you know Michael Jackson's in there?" I was like, "No, but I'm going to find out." So I went into work. I was on a late. It was what we called a late. I was working Saturday afternoon. I goes, "Right, Michael Jackson's here. See you later." And then I went to work. I went to stand outside the ward, and he came out, and he's about my height. I'm about 5'8", and he was wearing a hat and a herringbone jacket. It was really, really hot. He was very, very thin, very, very pale, And I stuck my hand out, and I went, and he had a bodyguard goes, "Shake that hand, Michael. Let's go." And I put my hand out, and he shook my hand. And he went, "Hi there," and I was like, "Oh." So it's disappointing.
Well, thank you very much.
And now you know why I wanted to avoid the question.
Still, thank you very much, Dawn.
You're welcome. You're welcome.
Becky, very quickly. Thank you very quickly.
Go on.
I've got one. Just a few comments coming in saying about the Zoom meeting and when we meet monthly, you've alluded to. Can we put it on our website to make sure that anybody that's here can find those details easily? Everybody is more than welcome. There's some familiar faces that have been with us from the beginning, but we would love as many people to join and join in those conversations with us. So, Becky, can we pop it on the website?
I think
if it's not already there, we'll make sure it's very prominent for you.
Yeah, so it's the last Tuesday of every month, which makes it really easy. Potential of us having speakers potentially quarterly. So that really just depends on the community's wishes. So our job as a town council really is just to facilitate as best as we can what the wishes of the community is. So we're trying, to just be able to facilitate that. So absolutely open to help. My email is becky.walsh@wsm-tc.gov.uk. I will put that on Facebook for you so that you can find that. So if you want to get an invite and know where to find me, if you haven't already received an email from me because I was emailing everybody, then at least you can find that, or you can find it on the Weston-super-Mare Town Council website. Dawn, thank you so much.
You're very, very welcome. You're very, very welcome.
We had so many conversations on this.
Can I thank everyone for your participation, for your openness, for having the conversation? Can I thank the council for having this sort of event? It is, you are an outlier in having this kind of a kind of event. I would expect to have this kind of event in inner city London. So I just want to give you proper respect for doing that. I've been made to feel so welcome. It was a co-produced event, and I've really loved everything that the questions I've been asked that were challenging, but and people have been so respectful and hearing it. So it's absolutely pleasure. I'd like to thank Becky for facilitating this conversation. Susan as well. She's been amazing, and thank the whole council for having this kind of event, which is the sort of event that should be happening across the world. I'm really glad I promoted it very far and wide, and I'm glad that I hope some of my friends internationally have come on this event, because I let them know it was happening, and I think it's a real exemplar of community involvement and engagement and the things that should be done. So thank you to everybody.
So thank you ever so much, and good evening. Hope you have a really wonderful evening, and we hope to see you again. Goodbye.
Bye everybody.